Bunions. What is a bunion? Otherwise known as hallux valgus, this is a deformity of the big toe joint. This type of pathology is usually manifested as a bump on the inside of the foot just behind the big toe. The bump can be very small or reasonably large, the size of which is not necessarily proportional to the amount of pain one can experience. Along with this bony bump there can be an associated bursitis, which is a cushion that the body originally creates to protect an area from pressure or friction, but after a while this cushion can also become inflamed and painful. The last component of this deformity is the deviation of the big toe as it moves toward the second toe, sometimes even underlapping or overlapping the second toe. What causes bunions? Poor fitting and high-style shoes are usually blamed as the culprit for the formation of this deformity, that is why they are more prevalent in women. Inherited foot structure. The truth is most of these deformities are based on a particular foot structure and the way a person walks. This deformity also creates an unequal alignment of the joint itself and causes the joint to wear out, over time. Once the joint is worn down sufficiently, pain ensues when you try to bend the toe while walking. Generally speaking, hallux valgus is a progressive deformity and in most people will worsen over time, if appropriate measures are not taken to remove the underlying cause. Bunion symptoms. Bursitis. The most common pain associated with hallux valgus is the pain that occurs from the inflamed basal sac, on the inside portion of the foot. Typically the area will be very red. Bump pain. Even without a bursitis, the bony bump can become painful, even conservative shoes like sneakers will cause pain. The size of the bump and the activity level of the patient are two factors that will lead to bump pain. In this instance there does not necessarily have to be swelling and redness. This pain is usually only evident when wearing shoes and will vary with the type of shoe being worn. Joint pain. The other type of pain in this condition is what is known as joint pain. As the big toe starts to move closer to the second toe, it creates an abnormal alignment in the big toe joint. This causes a premature erosion of cartilage, and over time the joint will no longer move smoothly and the patient will start to experience pain and limitation of motion of the big toe. This type of pain can be experienced both in and out of shoes. Bunion treatment and prevention. Just because you have this deformity does not necessarily mean you have to have treatment. In the asymptomatic or non-painful deformity, it is more prudent to find the underlying cause of the deformity and make changes accordingly. Conservative treatments. Orthotics. So what an orthotic does in these cases is to reduce the over-flattening of the foot, which then results in an improved alignment of the joint and reduction of pain in the joint itself. This therapy will not make the existing deformity disappear, but it should slow down or eliminate further worsening of the condition. Sensible shoes. Elimination of shoes that are either too narrow, too flimsy in support, or too high in the heel. Trying to wear a narrow high-style shoe with a large great toe deformity is like trying to put a square peg into a round hole, it just does not fit. This kind of mentality will eventually lead to a worsening of the condition. Cushions and braces that are sold for this condition are not my first choice because in most cases they just take up more space in the shoe and put more pressure on the bump. Aggressive treatments. Anti-inflammatory medication is fine for short-term use but should never be considered as a solution in that over the long haul the medication will lead to systemic problems in most individuals. Cortisone injections can be very helpful in those who have bursitis pain and to a lesser extent for those suffering from joint pain. Physical therapy can be helpful in relieving flare-ups. Surgery. The question frequently asked of me is when to have surgery to correct this deformity. My criteria is simple: when the pain of the deformity starts to affect your everyday life on a regular basis. You no longer golf, or go for daily walks, or go shopping with your friends out of fear that my foot will start hurting. Now the quality of your life is being affected. Having said that, keep in mind that hallux valgus surgery is not without risks, as is any kind of surgery, and that the type of surgery your friend may have had, may not be the type you will require. The well-trained podiatrist probably does at least a half dozen different types of procedures based primarily on the size of deformity. The type of procedure will usually determine the length of recuperation. Read the full article at www.foot-pain-explained.com/bunio.html.